Hello, thank you both for being here today. My name is Kiana Murray, and I am an intern at the Lesniak Institute. Would you guys like to introduce yourselves as well?
I'm Dr. Suzanne Buchanan. I'm the Executive Director of Autism New Jersey.
And I'm Eric Eberman. I'm the Public Policy Director at Autism.
Awesome. Well, we are so grateful to have you guys here. So the first question that I would like to ask is, do you know of any recent policies that will significantly influence the lives of individuals with autism?
Yes, we do. And actually, they're policies that we've been advocating for many years. Two recent ones that we want to highlight that happened in 2020, two bright spots of 2020, thankfully. One is Medicaid coverage of applied behavior analysis or treatment for autism. 40% of the state's children are covered. They have their health insurance through New Jersey Family Care or Medicaid. And so what we want to do is increase the number of kids with autism who have access to medically necessary treatment. And this policy change, which started April 1st of last year, is enabling us to do that. So far, there's only a small percentage of kids who are actually utilizing the benefit. So it is up to agencies like us and media opportunities like the one you're providing us with today to get the word out that kids on Medicaid have access to coverage for autism treatment. So that's huge news, I think, in our community. Anytime we get to help 40% of the state's children, it's a good day. And then the other big policy victory is licensure for the professionals who provide that autism treatment. I mentioned it was called Applied Behavior Analysis, or ABA, and the people who provide it are called behavior analysts. Yet up until last year, when Governor Murphy signed the law, there was no license to practice this profession in New Jersey. And so we believe at Autism New Jersey that individuals with autism deserve confident and skilled and compassionate professionals in their lives. And that simply can't happen without some type of state oversight or regulation. It was the Wild West, and we're hoping to raise the minimum standard on care with this licensure law.
Awesome. Well, a follow-up question to that is, what long-term policy changes does your organization hope to see happen over the next 1 to 2 decades?
I think right now our biggest initiative is around individuals, adults, and children with severe challenging behavior. In the state of New Jersey, we've seen just a lack of programs and services to really appropriately serve those individuals. So whether it's from a treatment standpoint or it's putting services into the home, or prevention also is one area that we're looking at increasing and trying to work with the state.
Okay, so could you go a little bit more into detail about what the process of putting that into action is going to look like, and possibly even how we as community members can be a little bit more involved in helping with advocacy and furthering the cause?
I think the first place the community can look is our website. It's AutismNJ.org. And under our public policy agenda section of our website, we have a link for severe challenging behavior. And that is where we've housed, we have a landing page for all things autism and severe challenging behavior and how people can get involved. The first thing they can do after getting to the site is looking at our policy recommendations. So it's a little 8-page booklet that we put together, 4 pages or so that describes the problem, because this is an unknown problem to most of the state. And then the next 4 pages talking about some major recommendations going forward, like establishing a leadership council on this issue and building up the workforce of specialized professionals who can help these kids and adults. We also want to identify kids earlier in their lives. We don't want to wait until they're 16 and can really pack a punch or really destroy property, et cetera. We want to make sure that kids like this are not ending up in emergency rooms or psych units and other inappropriate placements. Many times families resort to calling the police, or even over time they stop calling the police because it's just not effective, or the person has calmed down by the time the police arrive. We want to end this, this really vicious cycle of lack of access to care, and we want to build up the state's capacity to provide appropriate services. So I'd say the best place is to start with our website, go to our policy recommendations, connect with Eric or me, and we'll take it from there.
Okay, that's awesome. And as you were talking about the way people handle these situations, it just really, I feel like, illuminates the fact there's so much misinformation. And I guess this is kind of a follow-up question to that, a little bit off the record, but what do you believe is the biggest cause of the lack of informing about like what autism really is and how it really should be addressed?
Oh, that's a very loaded question with lots of moving parts. So I think with your permission, I'll narrow that down a little bit to autism and severe challenging behavior. And so I would say there's one main reason that individuals engage in severe challenging behavior, and it's because they don't have the skills to more appropriately communicate what is going on with them, right? That they want something to be, maybe they're hungry, maybe they want their migraine or stomach ache to go away. Maybe, many people with autism don't like changes in routine and they just don't understand why the routine changed. So it really all stems from great difficulty or total inability to communicate what they're experiencing in ways that the rest of us can understand. And so it's it's an unfortunate thing that they have to resort to aggression or self-injury or other things like to get whatever's happening to stop or to get someone's attention. And then sometimes those behaviors inadvertently get reinforced and it can set up a bit of a pattern. And so really it's our job as professionals to understand why the individual is behaving in this way, what they're trying to communicate, and how we can give them more appropriate and safer ways to communicate their wants and needs.
Okay. Yep, that makes a lot of sense. And what are some of the obstacles that you foresee impacting the effectiveness of your organization's advocacy efforts?
Eric, I feel like I'm monopolizing. Do you want to take some or you want me to take this one?
You can take this one, I guess. Yeah, I can jump in.
Yeah, I think it's twofold. I think the first piece is helping public officials understand the full spectrum of autism and that there are vastly different needs between the more mild end of the spectrum and the more severe end of the spectrum. And we can't just lump all individuals with autism together. So in fact, Eric and I were just talking about this earlier today, that it's just, you could have two very different people, someone who has attended graduate school and is married and holding down a job and has some neurodiversity issues or maybe personality differences and struggles in their own right, but they have a very different set of abilities and quality of life than someone who is severely impacted by autism, maybe has profound intellectual disability, and very few adaptive skills. And so it's our job as advocates to make sure that we're explaining that entire spectrum and that we're recommending supports that are appropriate for each person on the spectrum. The other piece is how the pandemic has changed everything. And while I think there was always a recognition of vulnerable communities, the autism community being one of them, now almost every industry across the state could be considered in a financially vulnerable position, right? Like a year ago, we never would have thought that we would be, shoulder to shoulder with the restaurant industry in Trenton, like looking for more funding for our community, right? So just every stripe, every person, every industry is now down and out in some way and disadvantaged by the pandemic. And so, we just have to make sure we're that much more compelling to public officials in terms of helping our community have basic quality of life.
Mm-hmm. Your mission is just so incredibly important. And, I would love to know, and I'm sure a lot of our readers would also like to know, how can we sort of contribute to the cause? And on top of that, like, how can we educate others? Because one thing I wrote down, even as you were talking, is how can we help individuals to see autism as a spectrum? Because I think there's sort of a very narrow image that people have of what autism might look like when there's so many different ways it can manifest.
Mm-hmm. Years ago, I was talking with a women's club. It's a volunteer organization that has chapters throughout the state. And it occurred to me, I was asking myself that same exact question, right? Like, how do I express the idea that if you've met one person with autism, you've met just one person with autism? You can't generalized, right? And that is a famous quote from Dr. Stephen Shore, an individual on the spectrum, so I want to give him credit there. But it occurred to me in that setting, sitting around in one woman's living room with 20 other women, to say, you would never say to yourself, oh, I know someone with breast cancer, like, oh, I know what they're like, like, because they all have their own personalities and likes and dislikes, etc. And so while there are some commonalities to autism, it's part of the person first language that I, as a professional, like to use is person with autism, right? Child with, like, they're a child first, they're an adult first, they're a human being first. And so we have to make sure that we acknowledge and we respect that individual as their own person first, and then look to see, kind of how all of the layers make up their complexity.
Mm-hmm. I love the way you shared that. It reminds me of something I actually was told a little while ago, where like growing up, a lot of times I would hear people with autism, like some people would refer to them as like somebody who's autistic, but then they said, instead of saying someone who's autistic, you should say a person with autism. And I thought that was such a great way to sort of shape that, because I do believe that people are complex, and I think it's very unfortunate that in society we tend to rely so much on like labels to sort of define how an entire person is.
Right. And it is really interesting because, some individuals with autism prefer the term autistic because it is such a core part of who they are. And if they can articulate that, of course, we should go with their preference, right? Of course, I will always use someone's preferences before any rule, right? It's about respecting the individual first and foremost. But I fear that for the more severely impacted end of the spectrum, that I don't want them to be reduced to the autism. I want people to see their personhood first. And I think that can get a little bit more lost in conversations, in for people with fewer abilities. We really want people to see their complexities too.
Mm-hmm. I just want to say I really appreciate the fact that this conversation is not even just about policy, but it is really about how we as individuals can be more sensitive just as a culture. And one of my last questions for you guys is, how will autism advocacy look different within the next 10 years than it did in the past?
Well, if we had the answer to that, it's a good question. Eric, did you want to do that one, or you want me to do it?
Yeah, well, I mean, for 10 years, it's a long way down the road too. So I think, like, not to keep harping on, severe challenging behavior, but it is a priority for us, and it's a big one. And I think we want to make sure that legislators and policymakers, they get the full gist of who we're talking about when we talk about autism. And I think in many cases, this population is, like I mentioned, is underserved, but just it's just not understood. And I think part of it is that when a parent has a child with autism and that child has severe challenging behavior, they don't have a lot of time to do much of anything else. And they get, parents really dealing day in and day out with the child. There's not the treatment services out there. There's just not that community to really provide that support. And I think a lot of that gets lost, and legislators and officials in the state departments, they don't hear as much about it. They don't see it. They don't really even know what it is. And we've had this conversation and going and talking to legislators saying, how do we explain this? Because many don't understand what severe challenging behavior is. If you Google challenging behavior or problem behavior, you typically get something about more of the mental health side of things, like a cutting behavior or such. It's really not just it's not an area that is spoken about, it's talked about. So when we talk about getting policies in place or standing up services that'll be there for these children, it takes a lot of education, a lot of information to get across, to the legislators and to officials to make sure they understand that there is a, part of this population that really has some pretty severe needs. So a lot of our advocacy over the next 10 years and pointing in that direction will be, in that space.
Mm-hmm. Would you also, oh, yes.
Oh, sorry, I was just going to add to that. I think that the disability rights movement has made tremendous progress in the last few decades. And there's been, of course, there's still so much more to do, but there's been so much more of an awareness of the more mild end of the disability spectrum, where people are focusing on, employment and transportation, and assuming a certain amount of ability and frankly independence on the part of the person with a disability. And so what Eric's talking about is kind of that second group. There's no formal, line in the sand or anything really, but the more severely disabled part of the population that, would very much struggle with those things without intensive specialized support. And so our priorities for that group are safety. You may consider that like behavioral safety, right? And then access to treatment. And if we don't have those two things, we can't even start to think about employment or volunteer experiences or transportation or community participation if they're not able to keep themselves and others safe, if they don't have access to the treatment they need. So I think, that's certainly where our advocacy will be in the next few years.
Mm-hmm. Okay, so I'm going to get ready to wrap the interview up here, but I do have one more question. How can individuals who want to learn more be in contact with you?
Well, we love working with everyone, parents, professionals, policymakers, interested community members, interviewers such as yourself. So anybody can call us at 800-4-AUTISM. That number works throughout the country. They can email us at information@autismnj.org, or they can just visit our website, autismnj.org, and all of our contact information is there.
Awesome. Well, thank you so much for being here. I'm going to stop the recording now, but I am so grateful for your time and your willingness to talk about these things.
Oh my gosh, thank you for the opportunity. You're helping us fulfill our mission.
I'm glad to hear it. All right.